Good morning.
Good morning, sir.
To Vadara, good morning.
Good morning, sir.
Very good. Fine. So, after a long gap of journey, online classes, we again meet. We are starting with case taking, case processing, and case analyzing. See, very difficult aspect of homeopathic practice is the case taking. What Dr. M.L. Taylor told, that well taken case is half cured. So once you are well versed with the process of case taking, and once you understand what data is important for analyzing and processing the case, so if you have that in the back of mind, then you can have a wonderful process called as cured. And what Master Hahnemann said, that rapid, gentle, permanent. So our process of learning is, we are going to learn rapid, gentle, permanent cure. But how to get that? That is what the aphorism number 83 to 104 is, case taking. So what are the difficulties you face during the process of case taking? We have a first interactive session, then I will go for the sessions. So what are the difficulty you face in your clinical practice? Tell me. See, many a time we came across a lot of case, a different version of the case. Sometimes we came across the acute cases, sometimes we came across chronic cases, sometimes we came across a physiological, sometimes we came across ICU cases, sometimes we came across a very urgent emergency cases. So the way of process of case taking is different according to that case presented to you. Okay. So what are the difficulties you face? See, all are clinicians, all are practicing. So you must came across a little difficulties. Even I myself also came across the difficulties. Okay. So you must came across the difficulties of the case taking process. So what are the difficulties you face in your clinical practice? Tell me. A little difficulty will solve the others' doubt also. Okay. Tell me.
In spite of following the performa, we still don't get what we want. That is the cause.
Okay, fine. So we need to search for one kind of cause. Okay, very good. Anything else?
ઘણા બધા common symptoms.
Write down the every questions what you asked for, and then we will solve that question. So today's approach to the case taking is the solving the problem and difficulties in case taking. So that is what I am here for you. So first case, in spite of the proper case taking, we didn't get a proper cause. Okay, fine. One. Second,
So many common symptoms.
so many common symptoms we get from the patients, and we didn't find any PQRS from the patients. Okay, anything else?
Introvert patient ની અંદર history કરાવે.
Very difficult to elicit the history in introverted patients. Very good. The third questions. Write down each and every question so I can give you a clue for each and every point. Anything else?
Many times we know the conflict of that particular disease, but we cannot probe the patient to give answer on that particular way.
Tell me the example. You know the conflict.
अगर कोई पेशेंट है जिसको लिप्स के रिलेटेड कोई डिजीज है, तो हम सोचेंगे कि लव के रिलेटेड कुछ ना कुछ है, तो उसको हम पूछेंगे ना, लेकिन पेशेंट के पास से कोई सेटिस्फैक्टरी आंसर ही नहीं आएगा और हमें भी नहीं पता चलेगा क्या पूछे और कैसे पूछे.
Okay. So how to form a questions according to the patient presented with the complaint and having a conflict. So according to conflict, how to form a questions and the patient will give you answer. Great. Anything else?
Sometimes we probe according to conflict. Situation बताता है patient, लेकिन उसमें feeling पूछो तो वो नहीं बताता. बस दुख लगता है, खराब लगता है, ऐसा बोल के छोड़ देता है.
Okay. So deeper probing of the each and every conflict, feelings and the behavior patterns. Okay. Fine. Anything else?
Rubric conversion.
The very difficult task is the conversion of the patient situation into
language
rubrics.
rubrics.
Okay. Very difficult. Okay. Fine. Then what else you have? Write down the questions. The conversion of the rubric patient language into rubrics. Okay. Anything else?
Rubric selection, priority.
Rubric selections. Okay. Priority. Fine. So rubric selection is based on the patient presenting to you with the which of the miasm. So miasm is a compass for us to find out which rubric is more important and which rubric is less important. Okay. So we have that clue. Fine. Anything else?
Sometimes extrovert patient expresses so many symptoms. So
Yes.
in that, what
So
to take?
We are in a chaotic stage, what to take and what not to, because patient comes a lot of things. Okay, very important. So there is a difficulty in even extroverted also and even introverted also. Very good. Anything else did you came across in your clinical practice? Difficulty in case. See, this is what a first pro forma is, the case taking difficulties. Then we have a different process. What Dr. Sejal asked, that how to analyze, how to take a rubric. This is a process called as case analyzing. Difficulties in case analysis. Okay, and difficulty in case processing. Processing means एक केस हमको मिल गया, अब वो केस में हमें क्या चीज को ठीक करना है, क्या नहीं करना है, वो हमें पता नहीं होता है. Sometimes we are in the phase that हमें क्या ठीक करना है, क्या नहीं करना है. That we came across. So we need to find out what should be given most important into the case. Sometimes Barata patient comes to you and he had some major complaint like hypertension, diabetes and everything. And diabetes went on increasing somewhat more than 300, 400. And he just complaining that, sir, I need to remove this patch. And this is a very itchy patch. So you need to understand what is most important. Sometimes we homeopath become like Barata in discussion. We need to cure that things, we are forgetting the rest. So that is what you need to probe, what is important. Okay. So this is in case processing. Okay. So case processing comes with the idea that what should be in a follow-up. That is called case processing. So we have a three format. One is case taking, second is case processing, and third is case analyzing. Okay, so case processing comes with the process of into follow-up. What should be better, what should be good, what should not be good. This is a case processing. Again, in the case processing, you have to analyze, evaluate the symptom. Which symptoms is most important according to the miasm, according to the affinity of the patients. Okay, and then analyzing in which you need to convert the patient's language into rubric. You need to understand what perception patient carries since childhood till date, and this perception make him sick. So this is what we call as morbid phenomena happening into the patient's mind, interior of the patient. That is called mind, and that is reflected outwardly in the form of sign and symptoms, which we call as a disease. Okay. So anything else regarding this?
Sir,
Yes, we can ask.
approach to the case.
Approach to
We
the
have
that is what we are going to deal with. So first point of my learning is the case taking. So how to take case in each and every cases. See, once you have pro forma, you take every time the same pro forma case, but it is not important in each and every cases. So once you come across the acute case, you need to take different pro forma. Once you have to different kind of cases like ICU, you have to visit the ICU or coma patient, then the different type of case taking is needed. Okay, so that is not actually the pro forma you are working for. Okay, so fine. So that is what we are going to deal with. Okay, anything else?
Psychic case taking.
Psychic case taking. Yes. So most of them, so that is what comes into the different categories. When to take
Disabled too. Disabled case taking.
specialized special child, case taking to the special child, or those who suffer from the Down syndrome, those who suffer from autism, those who suffer from. So in that case also you have to probe a deeper aspect. So what to take in the case. So we are going with the same. Okay, fine. Anything else?
ફિઝિકલ જર્નલ્સની અંદર થર્મલ ને થર્સ્ટની કઈ રીતે કન્સિડર કરવા, કેમ કે ઘણી બધી ડિફિકલ્ટીઝ થર્મલ કન્સિડર કરવામાં અને થર્સ્ટ સ્લીપ બધી વસ્તુ કન્સિડર કરવામાં
Yes. So this is what you have to more probe into the acute cases. So many a time in a chronic syphilitic cases or a deeper syphilitic or frank syphilitic cases, you need to forget the thermal and thirst because we need to deal with the life and death. So in that time you need to probe more syphilitic symptoms rather than thermal and thirst. So you have to take care of that things. But in acute, psoric acute cases, you need to probe thermal and thirst. So how to probe thermal and thirst? The question of case taking. Very good. Fine. Anything else?
Specific in chronic disease, chronic case taking, there are different disease. So in head disease, how we can approach?
Okay. So every disease comes to you with a certain pathology or certain physiopathological process. So first and foremost you need to have a knowledge of disease. So once you need to have a knowledge of disease, now our knowledge of disease is different than the knowledge of disease of conventional medicines. So what is our knowledge of disease? Knowledge of disease is something, disease is a defense process which is going on inside the human constitutions and which represent us with the three process called as sora, psychosis and syphilis. So our knowledge of disease is to identify which predominant miasm patient suffering from. And once we identify the miasm, then according to that miasm our case taking goes. So what I mean to say, if it is a psoric, purely acute and psoric cases, so different case taking. If it is a chronic sora, long standing psoric cases, chronic sora, then is a different case taking. If it is a pure psychotic cases, then is sora develop into psychosis, then is a different case taking. And if the patient presenting with sora, psychosis and syphilitic state, again the same method. And if the patient presenting you with the frank syphilitic destructive disease, then the case taking is little different. Okay. So for that you need to understand what are the miasmatic process. Already we have learned SCPH. So in SCPH we have syphilitic expression from exaggeration, distortions, hysterical perversions, then destructions, then autoimmunity and genetic mutation. So out of that we need to understand above 5 is a psoric. So in that sora is involved. The rest 2 is not soric. In that sora is not involved. Sora is somewhere else and it affects the patient with the perception. So there is a cause and effect. Okay, so there is a different kind of case taking in these two. Are you getting me? So it is a little bit higher version of understanding, but you can go through. So we are starting with the base, then we evolve gradually. So if we have a base, then we understand how to analyze, how to process the case. Are you getting me? So starting with the sora, and that is why today's topic is case taking in pediatrics. And, are you getting me? Why I have put this specifically? Because in an initial phase of your life, you get mostly psoric cases. In your clinical practice, mostly psoric cases. When you evolve gradually, you come across more sporocycotic, psychotic, and then you came across a syphilitic and genetic mutated or autoimmune cases gradually. So this is what our evolutionary process as well as the process of case taking. So what to take in pediatric case taking? This is what again we are discussing. This is not a class actually. We are just discussing what we need. If a child came to us, suppose a child of different age group, suppose a child of infant less than 1 year of the age came to us. If a child from toddler 2 to 3 years of the 2 to 5 years of the age, and if the child came to 5 to 10 years or 12 years of the age, so how to take a case in each and every cases? So what is to be? See, why I am probing, because many a time what we only have something in our mind, that only we ask. What sir always says, I do not see what mind does not know. Okay, so something which we have in the back of mind, we only ask that things into the patients, and we forget rest of things. So that is what we are polishing today, is the process of case taking. That sometimes we miss this point. This is very important in case taking. So we have to ask in each and every case. So starting with the case taking in pediatrics. So what are the point we have to ask in each and every case of pediatrics? So we have to understand this pro forma. This is just a pro forma, but you have to go through each and every point. See, still again this lecture is of so basic. Because why basic? Sometimes what my sir used to say, that you are BMR. What do you mean by BMR? Basal metabolic rate? No. It is basic में रड़ा. Basic में रड़ा. That means basic आता नहीं है. Okay? हमको जब basic नहीं आता है, we forget and we okay. मुझे ये आता है पर ये नहीं आता है. That is what you need to understand. So again we are going with the basics, case taking. So what are the case taking points we have to understand? So first and foremost, patient comes to us with the complaint, and that is what we understand, that is the chief complaint. So chief complaint has to be probed first. After the chief complaint, we need to understand the chief complaint could be a soric one, chief complaint could be a psychotic one, chief complaint could be a syphilitic one. According to that, we need to understand ODP, where it started. So all started with the SORA. So we need to find out the causative factors in each and every cases. What Master Hahnemann has told, that in a SORA you need to find out exciting causes in acute cases. In a chronic case you need to find out the fundamental causes, which is called as a miasm. But again, you need to find out each and every case. See, without cause nothing is happened. There is a cause and effect phenomena everywhere. Okay, so the cause is important. But back of mind, if we don't know what cause can produce that, so why we cannot ask to the patient. Okay, so back of mind we have that questions in our mind, what causes that causes. Okay, then we need to understand, we need to observe the patients, how he looks physically. This is what the very important aspect. We mostly look out this phenomenon. The child came to us, adult came to us, person came to us, we miss this phenomenon, physical constitutions. Sometimes we have seen, we have a constitutions in our S.K. Dubey book, the first introductions followed by thermal thrust, and then it was written constitutions. Very important as well, because constitution gives you a physical constitution, physical aspect of the individual. So many a time the patient, very tall patient comes to us and we think of इसको बराइटा दे दे. According to history इसको बराइटा दे दे. But बराइटा में तो लिखा है तो डॉर्फिस है, तो अभी हमको टॉल है और डल इंटेलेक्ट है, तो कौन सी दवाई देनी है? We need to understand that, because we have some mathematics, everything is there. Okay, fine. So there is a phosphorus constitutions, but phosphorus can be combined with Baraita phos. So Baraita phos can be very tall. Okay, so that you have to understand, because physical constitution we must mostly look out. We forget, we did not consider this into our case processing many a times. Okay. Generals. So in generals, all are aware of appetites, cravings, aversions. But the question to be put, certain questions, very important question to be put to the patients. What are the things which affect you? So we are going detailing this. Thermal thirst, sleep, dreams, bowel, bladder, perspiration. So these are what we call as generals. Input, tolerance, rest, output. That means excretions. So we need to understand the tolerance, input and output, and metabolic process. And the milestone and sensitivity. Very important aspect to ask these things in each and every cases. Because whenever you are asking the sensitivity, so sensitivity makes the persons sensitized, and that sensitized when compromised. That need was compromised. That need lead to development of two processes. One is the ideas which he formed into the mind, and one is the things which is behavioral pattern according to the need is compromised. Okay, I will give you in detail of that in the chronic case taking. And the mother's history during pregnancy. Most of in pediatric case taking you need to ask this. Up till 7 years of the age, the child is exactly mimicking the mother's. So for that you need to ask the mother history during pregnancy. Okay. Birth history, mostly the birth trauma. Nowadays we need to ask the mother history that this child is naturally conceived or artificially reproductive, because very important aspect. After 5 years you can get lot of IVF babies. So for that you need to understand the mother history during case taking is a little different. Okay, fine. So birth history, mostly birth history nowadays the all child came to us with the cesarean sections. So you need to ask the elective cesarean section, the process or any causes which is for the cesarean section. Okay. Sir used to say all cesarean sections child born is syphilitic. So either he may develop syphilitic disease in their life, recently or later, because this is syphilis. Breastfeeding history, most of time we must forget to ask this history. Okay, infant came to us with the 1.5 years old and he suffer from certain disease, physiological or pathological disorders. We must need to ask the weaning history. Sometimes we forget that history only. So that is what breastfeeding history is most important. Sometimes the mother says that I do not have breastfed my child because I did not get milk at all. So what kind of mother this is and what kind of the child is, you need to understand. So mother has no affection toward the child. That is why mother is not going to nurture the child. This is subconscious phenomena. Even though mother is carrying that child. Okay? That you have. And the child, even though in spite of giving the top feed, the child feeling that I have not bonded with my mother. So this is what the feelings of magnesia, orphanage feelings. Okay. So you need to ask the breastfeeding history. Mind and dispositions, a very difficult aspect of case taking is the mind and dispositions. Many a time we understand the physical proforma by the patients, and patient will give you all the details about the physics. But we need to ask, this is very important, extroverted, introverted, will, intellect, moral, reactions to stimuli, emotion, sensitivity, and attachment and disposition. So this is very important. And what Master Ailments says that disposition is the chief selection of, will help in the chief selection of the remedy. So whenever you are analyzing your case, this aspect is most important in your selection of the remedy. So that is what, from that you can take the rubric from dispositions, you can take rubric from sensitivity, you can take rubric from the will, you can take rubric from the intelligence, you can take the rubric from the moral, and from that you have to identify which is evolutionary higher version. Like in soric case you need to find out the psychotic, in psychotic case you need to find out the syphilitic, in syphilitic case you need to find out the frank syphilitic symptoms out of this all. Okay. See, so for example, the person is very lively, extroverted, jesting. So extrovertedness we understand, but in extrovertedness there is one component added. Most of time you always jesting on the lascivious part. So that is what a syphilitic, sexual extrovertedness, syphilitic aspect of that. So that is very important even in extroverted also. Are you getting me? So you need to evaluate each and every component with the higher version of soric, psychotic or syphilitic dispositions. Okay. So starting with chief complaint, most of time the pediatric age, in a small age group child cannot complain. So the mother or parents usually give you a brief history that my child is suffering from this, my child having this and these complaints. So you need to note down each and every complaint with the behavior. Again, in the child you need to observe the behavior of the child. Very important aspect, even with the chief complaint. Okay. I had given the same example of the fever in the very small babies 1 year 2 month old baby, and the mother complains that just he has a fever and little bit nausea in the morning and nothing else. And that fever was the whole body fever. But on examination I found the ear is cold. So this is what observation. So concomitant I took along with there is a frozen mouth and nausea. I have prescribed Epical. That was the case I have discussed in SCP's class. So that is what we have to find out. So most of time we need to ask in detail about the seat of disease. What is happening to the child? Why he is suffering from which day he was absolutely normal. Okay. So that is what we need to ask about the chief complaint. Mostly in pediatric cases you need to have a story complaint, fever. Many a time patient came with the only fever, cold and cough, running nose, breathlessness, bronchitis, bronchiolitis, and that are soric symptoms. Okay, diarrhea, vomiting, teething complaints. These are the complaints they are. So we need to find out where it is. When did this complaint start exactly? So the exactness is very important. So one of the child came to me with the fever, and he was very irritable and cranky. The young child of almost 1 year 2 months old. He was very irritable and cranky, and he got a fever since 2 days. So I asked what happened before 2 days. The mother said nothing, everything was fine. He has a mild cold and cough, but he was so irritable and this fever, and he did not sleep well, and constantly he wants me. I want to carry him. So that was the child dispositions right now. And I asked what happened. So mother says we went to some marriage functions, and in marriage function everybody is going to make him play. But he was so irritated with and he didn't like someone touch his cheek. So he is a very cute child, and someone is trying to make a love to that child, and that child didn't like that. So that is what the ailment started from. Okay. So what was the reaction? Child didn't like that, and he would become so cranky, irritable out of that. So from that phenomenon, I took the reaction that carries aversion to, and wants mother only to be carried and very irritable, cranky in the acute phase. I prescribed Sina to that child better within 3 days. So that is what you need to ask, when did the complaint start exactly? Are you getting me? When did it start? Exactly. So that is what you need to probe. You need to probe again and again. Did something happening in your school? Did something happening in your home? Did someone scold him? Did someone scare him? Did he saw something scary? So the mother did not know what causes this fever, but sometimes it happens. Okay. So you need to give a clue to the mother, that mother will tell you, yeah sir, this happened, yeah I remember that things, okay. We were seeing a movie, and suddenly the ad came, and that ad was something a scary ad, and from that ad he was frightened. So that is what ailment from fright and fear. Ailment from horrible things, sensitive to horrible things. So that is what you need to pick up that thing. So this is what you need to ask, when did it start? What were the events that occurred just before the complaint started? So that you need to ask the same things what I have explained to you. So many a time in a soric cases, you in your mind every event is very fresh. So you can remember everything easily, and you can give patient can give you the answer that this, yes sir, this will happen. This would happen to me, and after that it happens. So this is what very important. You need to ask the each and every occurrence happen before the complaint. Again, most of time in acute cases you need to find out the aggravating or ameliorating modalities. Okay. So when there is aggravating and ameliorating modalities, you need to ask, and that is very important. Some ameliorating modality will give you a clue to direct remedy. Some aggravating modality will give you to clue to the direct remedy. Say for example, it's not a case of a child, but it's a case of an adult. So the lady came to me with a complaint that she has a cough since 2 to 3 days. So it is a case of almost 1 minute history, only 1 minute history. She came with the complaint, 3 days history, cough, severe cough, and during even she's coughing in my clinic, she usually hold this chest. Sir, wo dukha hai. That was the pain she suffered from. So what we think of pain while coughing as a rubric? So there are many remedies. But she is to hold the chest. So I prescribed hernia. So that is what the aggravating or ameliorating modality will help you into the case. In children, what was the aggravating and ameliorating modality? The children having carried desire to be constantly. Children wanting mother to be with her. Children wanting to be rocked. Children wanting to be going outside on the bike and ride them. So that is the ameliorating modality. Rocking ameliorate, open ameliorate, carry desire to be ameliorate. So you need to probe. That is a very important. So whenever psoric cases, amelioration is most important because amelioration is psychosis. Are you getting me? Whenever psoriasis cases, aggravation is most important. So you need to probe the aggravation. Easy? So this is what modality is very important. You need to ask. And the most important aspect is what causes the disease. What causes the disease in the child is ailment from. So most important aspect of ailment from should be find out. Now this is very important to understand why ailment from is important. Because it excites. This is just an exciting cause. But why exciting cause? The child is sensitive to that. That is why they are sufferer. If child is not prone to or sensitive to or disposed to, then child will not suffer. You came across many a child, someone scolded him. The child did not reply to you. Or child is not affected by that scolding. Even child rebelled against you. So that is a different kind of child. And one child you kindly scold them. ऐसा नहीं करने का बेटा. And that child was affected very badly. Ailment from admonition kindly. That was the rubric. There is a 6 remedies. Even the small admonitions affect that child was, and that is it. So these 6-7 remedies are very sensitive remedy. And sometimes you scold, sometimes you reprimand the child, and child was laughing at you. So that is a different reactions. Are you getting me? So that ailment and that cause. See, according to ailment, if the child is scolded, child must have to be cried. Or child must have to be scared. Okay? Normally, in normal circumstances. But child is laughed at you when scolding. This is a graphitis child. Okay. So this is what you need to understand. What ailment and what is the reaction he developed after that ailment has happened. So this is what we have to probe. So most of the time the reaction in the form of disease, one, and reaction in the form of the behavior or the reaction according to the miasms. So if it is in a psoric stage, the reaction would be a psoric one. If it is in a psychotic stage, the reaction would be a psychotic. If it is in a syphilitic stage, the reaction would be a syphilitic. Okay. So ailment from. So in case of infant and the toddler, we have to think about all possible possibilities that must have caused this problem. So we need to ask the possibility, starting with the physical cause. Okay. The physical cause is also most important. Many a time we came across, just we need to probe a mental cause, and we didn't find any mental cause. But we don't know actually the physical cause has happened. Are you getting me? So that is what you have to find out. The physical cause is very important. So first and foremost thing, in a childhood history, we need to ask the vaccination history. Did you underwent the vaccination in recent 1 week? If the child comes to you with the complaint of the fever, diarrhea, cough, vomiting, any sorry cases, you need to ask, did the child underwent vaccinations? First questions. So what question to be asked in the finding out the cause? The first question to be asked, the child underwent any vaccinations. Okay. So then if yes or no, according to that, after that what happens, you need to probe. If a child is prone to that, then it is very important. सर कोविड वैक्सीन दिया था, उसके बाद ही इसको तुरंत फीवर आया, सुबह में वैक्सीन दिया था, शाम से फीवर आने लगा. That is what ailment from vaccinations. Okay, our body is compromised to that injury and body is defending in a soric way. That is what it produces. Revolutions in the organism produce a fever, exalting the sensitivity. This is aphorism number 74. Malnutrition. Most of time you need to ask, did he ate properly? What was his diet? Her diet is. सर कितने दिनों से खाना बराबर नहीं खा रहा है, बुखार तो आप आया, रिपोर्ट कराते हैं, हीमोग्लोबिन was 5.6, malnutrition, anemia. Okay, so that is what you need to find out. The child has been fed properly or not. Okay, most of infants are on the milk only, no other foods. After 9-10 months, no other supplementary foods are given, only milk, bottle-fed milk, and he went into anemia. Again, you need to probe that. Okay. So is mother getting sufficient milk or not? If it is small child, 6 months, less than 6 months, so you need to. According to their age, weight must have to increase. According to their age, infant weight must increase. Say for example, up to 6 months of age, every day 20 to 30 gram body weight is increasing. After 6 months, that the ratio of increasing weight was reducing to the 10 to 20 grams. Okay, depending upon the child constitution. So you need to probe. So 2 weeks before the weight was this, after 2 weeks the weight has to be increased, but weight is reducing. So something is going with the compromising the sora, and that sora is the food. Okay, insufficient supply. Again, the child has weaning. I told you that thing. If weaning has started, is he given the right kind and right quantity of the food at the right intervals? So weaning तो करवा दिया, पर अब बच्चा खाता नहीं है सर. Again, that also causes malnutrition. Is the child overfed? पूरा दिन दूध ही दूध. सर दूध ही पीता है और कुछ खाता ही नहीं है. प्रॉब्लम क्या है सर? खाना बहुत खाता है, जाता नहीं है. Constipation. Ailment from constipation from bottle-fed babies, infants. Illumina is the remedy. Again, you need to probe any medications. So before asking any emotion that happen or event that happen, you need to ask some physical causes. So any medication was a child is on any medication prior to the present illness. कोई दवाई चालू है. Sometimes child was given vitamins drops, unnecessary vitamin drops, which is not actually required, but the prescription is going on and the child is taking. So sometimes abuse of iron tonic, the pulsatilla is the remedy. Okay, so that we need to probe anything which is child is on medications or not. Or sometimes after medicine child may develop some skin rashes or something. So this is what oversensitive to medicament also. So that you need to probe. So these are the physical cause. Before asking a mental cause, you need to probe that physical cause. The question is like that, and then the emotions has to be asked for. So what event happening before this? He was normal. What happened? So you need to ask. Now we need to find out the emotional causes in pediatric age group. So we need to categorize each and every pediatric age with the particular causes. So infant has a different emotional cause, the school going children has a different emotional cause, and even a college going or an adolescent child having a different emotions. So according to that we need to probe a certain questions. Something is happening, what is happening? Now if the 15 years boy or girl came to you and having a complaint certain, and you know the conflict. This is conflict with some partners. Okay, so what question you need to probe? So you need to ask about the periphery. You need to frame the periphery. And then after framing the periphery, you need to go deeper into the center. That is what the art of case taking. Sometimes we know the conflict, but we didn't have to ask directly the same question to the patient that this is happening to your life, but you are not telling me the right things. So for that you need to ask the peripheral questions. And then periphery goes into, your target should be reached to the core. So peripheral question goes toward the core, that patient will telling you the right things. Okay. So the emotional causes in infant. So what was the emotional causes happening in the infant? So mother who used to be with the child for 3-4 months resume her office duty suddenly. Okay. Now what happened in that case? See, this is the situation. Now you have to convert this situation into rubric. This comes into repertorial analysis, or what we call a case analysis. So first we have to write down everything. So mother started working, after that the child behavior has been changed, the previous behavior was this one. So that means you need to understand the child need was compromised. What was that need? Need of being taken care, loved. Okay, so child becomes so different. So that is what, according to the miasm inside him, the reaction pattern started. So you need to probe. So most of time you need to ask, are you working mother or a full-time mother? Okay. So baby with whole day the baby with his mother or grandmother or some caretaker. So what was the baby's reaction when you came to the home? What was the baby's reaction when you leave the baby to the someone else as a caretaker? So you need that things, and from that you need to find out the reaction. If it is a child is very small, infant. Okay, so infant means up to 1 year of the age. So child is kept away from her mother because mother fall ill. Sometimes it happens, the situation. Sir, mother has mastitis and she underwent the operations, breast abscess is drained, so she is there, child is there, and after that, so we are giving milk, બીજા breast માંથી milk આવે છે તો અમે milk આપીએ છે, but mother નથી. Okay, so what was that? Away from separation. So that separation lead to, we know the child develops some rashes, mostly regarding ear, okay, or lips. Okay, so that is what they are missing, the loved ones, they are missing the love touch. So these are the different kind of remedies. Okay, so conflict between parents. So infant, even though infant is a very small for the age up to 1 year, but the environment happening something in the family, infant perceive that environment, and that after that environment is perceived, he develops certain ailments. So that you have to ask for. Is any fight in the families? Did something is happen? Did he scare from something? Most of time the emotion, the primary two emotions comes into the child. The first is fear, and the second emotions is the anger. When the child is growing up to 1.5 years or 2 years, then third emotions comes was the jealousy. So we will go for the emotions also later. So this is what conflict between the parents, or conflict between the in-laws, conflict between the house. So that create also. So what was the, if it is happening and the child is sensitive to discord at home, sensitive to discord between chief and subordinate. So that you have to understand. These are the remedies come into the case processing or analysis. Interruption in the feed. See, right now we are just going toward the case taking process, not analyzing. Analyzing part comes later on. Okay. Interruption in the feeds. Most of the time the mother has to be in a hurry. Or mother will go, okay, I will feed him for 5-10 minutes and again I need to go to my office. So this interruption also can cause irritability and anger in the child, and that also creates some disease process. So you need to ask. So frightened by something, either a noise. Most of time the child is frightened by the loud noise. So many a time you came across the child that during Diwali time, when the crackers is noise of the crackers can cause frightening situations. Sometimes it happens in the monsoon season also, thunderstorm noise. Some children got scared of that thing, so they are sensitive to thunderstorm. So you need to find out that the frightened by the loud noise. Hit by the mother. Most of the common causes, see, mother is safe, yeah. So mother hit the child because of some irritability and crankiness, and again that create a disease. Okay. So you need to ask. Newborn sibling into the house. Again, 1.5 years old infants and another infant came, another child came into the family. So all the attention from this child to newborn. Okay, and that lead to the problem in that child. If the child is become so hyperactive, overactive, goes into antic place, the child will be Alzheimer's. And if child is sulking, grieving, weeping, nervous, the child is ignatia. The rubric is newborn takes the attention, jealousy general. That was the rubric. The ignatia and Alzheimer's are the remedy. Tell me the whole rubric from the complete repertoire. Newborn. Type a newborn. Did you get? It's a big rubric.
Delusion, imagination, born newly, overwhelmed, at novelty of surrounding.
That was it. Newborn take the attention. Jealousy, newborn. That was the rubric.
Jealousy, children in baby takes the attention of the family away when siblings rivalry.
Yes, exactly. That was the rubric. The remedy is ignatia and Alzheimer's. There are, I think, two, three or more remedies are there.
42
Okay. Kara has less remedy. Complete has more remedies. Okay. Natramure is there. Calcarea sulf is there. No? Calcarea sulf is there. I know.
Ignatia,
So there are many remedies added. Great, fine. But most of time the Alzheimer's and ignatia will cover the case. This is what the clinical application of the these situations. Okay. Now school going children. Children become little bit more elder. Like he was over 3-4 years. He went to nursery, he went to preschool, he went to juniors and LKG, UKG, and then went to the schooling. So during the schooling stage, you need to ask the certain questions for the child. First and foremost, you need to make a rapport with the child. Very important aspect of the physician to make a rapport with the child. And if the child is comfortable with you, then and then they will give you the answer. Otherwise, child will not give you the answer. I used to have a habit that I kept always a chocolate in my cabin. Whenever a child comes to me, I just offer a chocolate. So he must feel, or he or she must feel, I am comfortable there. Even though Ophidia child comes to you, they will not take immediately the chocolate. They hesitate. They see that something, and then gradually, whenever your eyes is somewhere else with the mother talking, you are talking with the mother or something else, that child manipulatively take the chocolate. So this is again, this small observation help you that this child is Ophidia. Okay. So first and foremost thing, you need to make a child rapport with the child, and when the rapport is building, you need to ask a happy moment first. And then happening in the school. Okay, so I used to have one toddler. Almost he was in UKG, and he came with the complaint. Mother and father came to me recently. He came with the complaint that he didn't eat properly and he has a nausea and vomiting in the morning whenever he used to go to the school. So I asked, something is happening. He didn't like something, because nausea and vomiting is a sign that I have a discontent and I have a anger and I have a disgust for something which is happening in my setup. Okay, so what actually? So I asked, are you going in auto or going in van? Saying, I am going in van. Okay, you are enjoying in a van? No sir. क्या होता है? वो सर आयन से ना वो मेरी खींचता है, मुझे बोलता है. क्या बोलता है? Then he open up and he said कि मुझे वो हम लोग साथ में खेलते हैं तो मेरे साथ खेलता नहीं है, मुझे अलग कर देता है, and that is what something is happening to the child. So that need was compromised. Even I used to carry my bat for a playing, and they used to play, but they never allow me to play, and they always apart me that we don't want to play with you, and that affect that child. So that is that the person feels neglected. Their importance has been neglected. He didn't care for, and out of that, so that situation you need to probe to the child. Again, you need to ask something in the school. So I used to remember one case about the punishment. So the child was playing in the ground, in the playground, in the buildings, and mother said that you play here, and mother asked one dadi that you look at that child. I am going to buy some groceries. Okay, so mother went away, and child was playing, and during that the child was doing mischief, and that dadi scolded him badly. So that child was sit quietly on the bench and he was sulking. So mother came from buying from grocery, and mother noticed something is happening. Why you are a playful child, very restless, never sit in a proper place, and suddenly you sat there and you are sulking. Something is happening. So, and after that incident, next day he went to have a fever. Okay, so mother came, and the situation was asked. So mother told the same situations, and mother asked that dadi, what happened? क्या हुआ इसको? So दादी said, बहुत तूफान कर रहा था तो मैंने डांट लगाई थी. फिर शांति से बैठा. अभी शांति से ऐसे वैसे. So that is what something. So again, in the situation, what was the things you need to understand? First, ailment from admonition kindly. One thing. Ailment from reprimands or sensitive to reprimands. Ailment from reproach. Or you need to understand punishment. Now what was? If it is scolding, what was the reaction? रोना चालू करेगा. Most of time rudeness can make you cry. Okay, he become quiet. So that means he is sensitive to punishment. That is called, अगर तूने कुछ किया तो मैं तुझे कुछ सजा दूंगी. So keep quiet and keep mum. So he like this. So that is what the ailment from punishment. So most of time you need to ask that things into child in the what happened. कौन से टीचर अच्छे लगते हैं तुम्हें? कौन सा टीचर बहुत अच्छा है? कौन सा टीचर प्यार करता है? पहले ऐसा पूछना है. तो वो बताएगा ये. फिर पूछना है कितने टीचर हैं? 4 टीचर हैं. कौन से बहुत अच्छे हैं? ये. कौन से अच्छे नहीं लगते हैं? पीछे से एक क्वेश्चन डालना है हमको. तो बच्चा बोलेगा वो टीचर अच्छा क्यों अच्छे नहीं लगते हैं? बोलते हैं, डांटते हैं, वो डर लगता है. And that was the ailment. कुछ बोला था? अभी 2-3 दिन पहले कुछ बोला था? हाँ सर, डांटा था, हम लोगों को सबको बोल दिया था. So that was the things that punishment is happening in the skill. So this is what the developing the skill. Why I am asking? You need to ask पहले periphery. From periphery you go deeper into the core of asking the questions. Very important of framing the question to find out the ailment. Now most of time a little ambitious children comes to you. Always mother and father always appreciate, put the photo into Insta that my child got 98% and all the compliment from the world comes to their Insta post and child was happy. Appreciation, desire for. And suddenly child didn't get what he or she expected. Okay, he got 80% and her friend got 85%, and that makes her sick. Ailment from losing rank in the school. Ignitia is there. There are the 5 remedies, but Ignitia came into very near. So this you need to understand. So why it happens? Again, I am the best student in the eye of the teacher, but teacher did not make me a monitor. Teacher made me a monitor to my friends. I didn't like that, and that made me afraid. So what was that? Again, envy and elevate from loss of position. Lycopodium is the remedy. Okay, so you need to understand these things. I am very diligent. Teacher told me, mother says, घर पे इतना तूफान करता है, स्कूल में जाते तो टीचर बोलती इससे बढ़िया लड़का तो मेरे क्लास में कोई भी नहीं है, इतना शांत, इतना इंटेलिजेंट, सब जवाब देता है, सब एकदम होशियार है मेरा लड़का. और घर पे दादा किसी को भी मारेगा. So that is what the lycopodium is. So you need to probe that things also. So position, losing rate. So disturbances with the frame, either jealous or ignore or insecure. What I tell you the situations. So most of time the ignored feeling mostly in the small children. वो मेरे साथ खेलता नहीं है, मेरा फ्रेंड होके भी मेरे साथ खेलता नहीं, मेरे जो भी टॉयज होते हैं वो लेके जाता है पर मुझे नहीं खिलाता है. Again, ignored. Okay, so that is what the feeling of being neglected, feeling of being alone, and that creates insecurities. Okay, so humiliation in the class, most of time it happens. टीचर ने सवाल पूछा, जवाब दिया, गलत हुआ, सब लोग हंसे, प्रॉब्लम चालू दूसरे दिन से, सब लोग मेरी हंसी खिली उड़ाते, and that is what she feels or he feels humiliated. और टीचर ने सबके सामने मेरे को बोल दिया, बुद्धू तेरे को तो कुछ आता ही नहीं है, and that is what causes humiliations in the patients. So that affect the parent strictness. Most of time mother always told the child, if you do mushes, I will tell your father, he will come to you and he will beat you. So whenever father came to home, father was very mild, but whenever father came to home, they all are started studying. Strictness. Okay, but what? This is the perception they had made about the father. Okay. So that is what strictness. Or in actualness also there is a strictness of the parents. That also. So most of time ailment from domination, strict process. So here the ailment comes as a domination. Parent quarrels. Many a time disharmony in the family which leads to the quarreling. So this disharmony can cause effect into the child. The child is sensitive to quarrel at home. Natrum is the remedy. Failure in the studies, most of time. So here losing rank, but here I cannot reach to the level. I cannot. कुछ होता ही नहीं है मेरे से. That is what lack of confidence comes into here. Why? Because many a time he used to start something and someone is telling you इसको कुछ नहीं आएगा, and again he loses his confidence. So here they suffer from the low self-esteem. and that create a lack of confidence, that create a timidity, that create a bashfulness, that create a embarrassment. These are the things of the low self-esteem. Are you getting me? These are the rubrics you can find out in the low self-esteem. Okay. Now, so these are from the schooling children. Okay. Now you came across adolescence. The child went into the college, or according to your age, you are also a child. College students. Okay. So first and foremost, ambitious persons. Right now it is NEET, JEE. I am going into Akash Baiju. I am going into that Helen. I am going into. This was the institute, but we have Akash Baiju. So that was the institute, and sometimes his or her wish to get admission into that institute, and somehow his admission is pulled. So that make a disappointment. So ailment from disappointment general. It is not love. Ailment from disappointment is there, only one rubric is there. And ailment from disappointment in love also there is a different rubric. Okay. So there is a disappointment. You didn't get any desired result or desired admissions. Okay. After getting admissions, they may suffer from the ragging. So ragging can be anything. Can be anything. They laugh, they bully, they criticize. So this child is mostly sensitive to that. Laughing, sensitive to mocking, sensitive to bullying, sensitive to criticism, sensitive to reproach. Or sometimes they feel they are being abused, they are being humiliated. Okay. So these are the things which happen. So that sensitivity got hurt, and that create a problem. Abuse sexually or mentally. Okay. Most of a small child, not sexually, not physically sexually, but sometimes verbally the abuse also child feels sexually abused. Many a time. Okay. So that also happen. Or physically in the college, in the traveling, or in the homes, or in the surrounding. Something that happens, someone is teasing, someone is behind her, or someone is going to hurt them. That also produce feeling of abuse, either mentally or physically or sexually. Okay. Failure in study, again the same child went into. After failure in study, they loses their confidence. They goes into inferiority feelings. I didn't get. So they may develop a certain delusion, perception that I cannot succeed in the future. Delusion, failure, delusion, fail. He will be. वो जितना भी प्रयत्न करे, I will fail again. So this is the inferiority complex perceptions. Okay. The complex about the money and status. Most of time this happen in this nowadays situations that उसने ये ले लिया तो मेरे पास भी ये होना चाहिए. गेम PS4 उसके पास है तो मेरे पास भी होना चाहिए. उसके पास वो बाइक है तो मेरे पास भी KTM बाइक होनी चाहिए. उसके पास वो है तो मेरे पास भी ये होना चाहिए. हम लोग वो काफे में खाने जाते हैं तो मैं भी जाऊंगा. So that is what the complex they are complex. So here they are always comparing their status with the someone else status. And when the crisis happen, either money or a status, they may suffer. फ्रेंड का बर्थडे था, उसने बोला कि तेरे को तो ये गिफ्ट देना पड़ेगा, अभी इसके पास पैसे नहीं है, गिफ्ट कहाँ से लाएगा, और नहीं दिया तो जब बर्थडे पार्टी में नहीं जा पाया तो सबने उसको बुली किया. उसके बाद प्रॉब्लम चालू. अगेन दैट वाज फॉर एलिमेंट. सो मोस्ट ऑफ टाइम दिस इज व्हाट स्टेटस, कॉम्प्लेक्स अबाउट द मनी एंड स्टेटस. अब यहाँ तक तो सब लड़के लड़की और लड़की लड़की थी. अब लड़का लड़की दोनों साथ में आ गए. अभी बातें चल रही है, क्रश चल रहा है, मजा आ रहा है, खुश हो रहे, पार्टी शार्टी हो रही है, एंजॉय. तब तक सोरिक है सब. अभी दोस्त लोग उसकी उंगली कर रहे हैं, वो उसको बोल रहे हैं यार तेरे को लाइक करती है, तेरे को लव भी करती है, तेरे को समझ में नहीं आता है. तब उसके अंदर वो फूटता है, क्या बोलते हैं, लव का जादू, लव का वो ब्लॉसम होता है, फ्लावर्स. When love blossom started and suddenly उसकी गर्लफ्रेंड ने बोल दिया, मतलब उस लड़की की फ्रेंड ने बोल दिया, अभी वो तेरे को लाइक करता था, तेरा बेस्ट फ्रेंड है ना, वो बेस्ट फ्रेंड नहीं रहा, वो तेरा लवर बनने वाला है. और लड़की गॉट हर्ट, मुझे उसके साथ बात नहीं करनी, आज से बंद, बात करना बंद, चालू. अभी ये हो गया देवदास, वो हो गई पारो. ये अक्सर ये सिचुएशन एडोलसेंट स्टेज में देखी जाती है. तो दैट इज व्हाट डिसअपॉइंटमेंट इन लव. सो पारो कोई और जगह जाएगी, फिर वो गया, चल दो, अब मैं दूसरा बॉयफ्रेंड ढूंढूंगी. फिर वो गाना गाएगी, ब्रेकअप वाला, ब्रेकअप सॉन्ग है ना, आज मैंने ब्रेकअप कर लिया, फिर वो कर लिया, मेकअप कर लिया, फिर जाके और वो देवदास होगा, वो क्या करेगा, okay. So this is what they are compromising their needs, and that need has to be compromised. So this is what disappointment in love, purely a storic one, but again it goes into a deeper version, and that impulse. Sometime you heard the story which happened in the recent 3 years back in the Surat, that one boy has a love affair with that girl, and that girl was not agree, so he killed that girl. So that is a syphilitic aspect of love. Are you getting me? That is a syphilitic. Even the disappointment lead to the killing of someone else, which he loved the most. So that is a syphilitic aspect. So the reaction is based on what miasm he is indwelling inside. Sora, psychosis or syphilis. Till now we are working in the soric. So I gave you example of Sora only. In psychosis what happens? तू नहीं तो तेरी दोस्त सही, मेरे को तो चलेगा. That is psychotic. Disappointment love goes into proliferation. Disappointment love goes into adultery. Disappointment love goes into lascivious things. Disappointment love goes into multiple partners and relationships. So he becomes chronic acid, roadside Romeo. Are you getting me? So this is what Sora, psychosis and syphilis, according to that reaction. Again, most of time you can get this history. You have to ask what are the hobbies you are. Are you in sport or something else in the case history? So if they say yes, I am in the sport, I used to play a badminton very good, and I used to play badminton in the state level, in the district level, but after that I didn't go anywhere. We ask why. So my father was very strict, we did not allow. After that I was in the situation that my father died, and I need to take responsibility of the family, so I need to have this a different story. I left that sport. I was very good in sport, but I need to left that sport. So that is what the thing, failure. Or sometime he was up to state level, and in the district level he failed. So again he loses the rank and that problems. So again here the position has been lost, failure. So most of time they goes into a low self-esteem feelings, and that low self-esteem feeling goes into low confidence, inferiority complex, and then all the disposition. So these are the emotional causes in the college. Now we have seen the emotional causes. These are the situation happening into the life of the child or pediatric age group from the 0 to 18 years. Okay. So almost our whole case taking has been covered. Now emotions comes into the play. So I said most of time the infant and children have the first and foremost emotion was the fear and fright, the primary emotions. Okay. So what happened? How it happens? Fright and fear. So sudden noise either of the pressure cooker or utensil falling or breaking. So child was startled, and that was creating the fright. So that is what, these are the situation you need to understand. This is a fright. Are you getting me? Okay. Second part, any stranger or new person who carried him. अभी एक वो केस बताया ना मैंने, सीना वाला. They want to caress, but the child didn't like. So he was not in the fear state, he was in the irritable state. So this is the reaction will tell you that the emotion is anger. Are you getting me? Okay. Vaccination or any other injection given to him or some procedure performed on him. So whenever this happening into child, when child enter into your clinic, child behavior was telling you that he was scared of doctors. That again वो मुझे injection मारेगा. So that is again a fearful and fright. Physical abuse. So physical abuse मतलब मारा, मम्मी ने, पापा ने, किसी ने भी मारा, दोस्त ने मारा, डर गया. उसके बाद डर गया. I had one of the case. A child was used to play with the small dog in the garden, and he was playing with the small kid dog. What we call as kid dog? Puppy. Yes, it was a puppy. Yes. So he was playing, and suddenly puppy's mother came, and that mother dog was barking against the child, and child was frightened. And after that frightened, he ran, and that mother dog ran behind him, and next day he got cured. Okay, so that was the case of opium. Ailment from sudden fright. He was enjoying, and then suddenly it happened. So this is what physical abuse. So sometimes physical abuse from this way or this way also. So sudden darkness because of the electricity problem. Most of the time it happens in everyone's homes. Nowadays in our cities the lights didn't go often, so it happens. But in a previous day it happens, and the child was scared. So light off, child was scared, stammering, panic state. Somebody shouted at him suddenly. So in the school, in the home, in the playing areas, someone shouted. So that also creates a fright. So these are the situations which makes the child to fear, and the emotion comes as fright. Okay. Cat in the house, either bark at, or same example what I have mentioned. Watching horror show, mostly it happens. चुड़ैल आती है. Nowadays this is very important. You used to ask the mother what child loves the most. Mother says, he used to play the tablet, he used to go to YouTube and he watching shorts and everything. Okay, fine. You ask the mother, did you check the history? What he used to show this? And mother says that yes, he saw चुड़ैल वाला कार्टून देखता है, ये कार्टून देखता है, उसके बाद रात को उसको डर लगता है. And that is what watching horror show. So like to watch the horror, and the horror intensified, and then he got into this. This is remedy is Mancinella. I had prescribed Mancinella to the case. Hearing stories of ghosts. Most of the YouTube, see, these two are the YouTubes. Okay, right now. So practically you can find in this. So you need to probe the cause. You need to ask that and find out. Fight at the home between mother and father, or mother and grandparents, most commonly the quarrel. Quarrel can lead to a scare. Quarrel can lead to anger. Why anger? If the child is sensitive to injustice, he must have anger. If child wants harmony, he must have be fearful. मुझे शांति रखनी. Injustice होगा तो बोलेगा पापा तुम्हें गलत छो. You don't do like this to my mother. Okay, that is what they are. So this is what the reaction is different. So you need to probe. ये हुआ था, इसका reaction क्या था? Every time you ask the reaction. He is put in a play, a school, or he is either scared in the new environment, or he is missing his mother. So most of time this happen into the school and new environment. Okay, or scolded by teacher. टीचर ने डांटा, उसके बाद क्या किया? गुस्सा करके ऐसे करके बाहर आया, रोने लगा, डर गया, चुपचाप हो गया, सलन हो गया. सो फियर का रिएक्शन डिफरेंट आएगा, एंगर का रिएक्शन डिफरेंट आएगा. सो इमोशन सैड एंड सल्की. ओके, So sad and sulky. The mother has stopped breastfeeding him suddenly because either she is not getting milk or she has started going to her work. Child become irritable, cry, sulky, morose type of sadness. So this is the different story. Child is kept in a babysitting as parent are working. क्या बोलेंगे? जब मम्मी छोड़ के जाती है तब थोड़ी देर रोता है, फिर चुपचाप बैठा रहता है, कुछ करता नहीं, प्ले करता है, थोड़ी देर खेलता है, फिर नहीं खेलता है. क्यों? उसको अच्छा नहीं लगता है. जो चीज पसंद नहीं है वो करनी पड़ती है. सैडनेस. राइट नाउ वी हैव लर्न द सैडनेस इन SCPS. मुझे अच्छा नहीं लग रहा है. That is creating the sadness. Okay? Arrival of the sibling in the family. So there are different kind of reactions. Okay? Child becomes sad and sullen, morose, don't want to talk, and child always says, अब आप तो मुझे प्यार ही नहीं करते. Pulsatilla. Blackmail says you do not love me. Tuberculinum and pulsatilla. These are the rubrics. Okay. समझ चुके हैं? He is away from mother due to some reason. Father is traveling constantly. He is missing his father. Most of time doctor kids are missing because doctor is busy in all day practice like me. So child is missing, father कहाँ है? Okay. Joint family suddenly separated. This commonly happens right now. So sad and sad. सर जब हम लोग साथ में रहते थे, नाना नानी दादा थे, इनको दादा के साथ बहुत अच्छा है. तो जब हम लोगों ने नया फ्लैट लिया, दादा दादी उधर रहते तो हम लोग यहाँ आ गए. इसका स्कूल यहाँ पे है तो हम लोगों ने स्कूलिंग चेंज किया तो हम लोग स्कूल यहाँ आ गए. अब जब यहाँ आए हैं ना तो ही ऑलवेज से दादा कब आएंगे, मुझे दादी के पास जाना है, मुझे यहाँ अच्छा नहीं लगता है. एंड दैट सैडनेस सलननेस कम्स इनटू द सो फीलिंग सेपरेटेड. Child may develop dermatitis. Child may develop skin eruptions because separated from the loved ones. Okay. So maid who was taking care of the child was suddenly left the job. It happens sometimes in a higher middle class family. The mother father both are working and the child has attachment with the maid. So maid was very good in taking care of the child. They fulfill all the demand. And suddenly maid left. The child was missing that, and that creates sadness. Okay. So in sadness, what was the things? These are the love remedy comes into the play. Okay.
सर एक केस था, मदर फादर दोनों डॉक्टर है और बच्ची है ना स्कूल नहीं जाती है. कब से? तो 10 दिन से. क्या हुआ? तो 10 दिन पहले मदर फादर दोनों घूमने गए थे दुबई. बच्ची यहाँ पे थी अपनी दादा दादी के पास. तो 2-3 दिन स्कूल गई, फिर स्कूल जाती है ना तो रोती है. तो उधर से उसको वापस लेने आना पड़ता है. पूछते हैं क्या हुआ, तो मम्मी चली गई. तो फिर मम्मी वापस आ गई, फिर स्कूल भेजते हैं तो फिर भी वापस आ जाती है. मैं घर गई और मम्मी नहीं होगी तो डरती है, रोती है, फिर घर आ जाती है. फिर घर पे आके एकदम नॉर्मल, कोई दिक्कत नहीं. तो वो मैडम जो है वो होम्योपैथिक डॉक्टर है तो उन्होंने पल्सेटिला दिया क्लिंगिंग लेके, कोई रिजल्ट नहीं मिला. तो मेरे पास आए थे. तो क्या होता है, मैं घर आई और मम्मी नहीं हुई तो उधर ऐसा नाटक करती है कि मुझे पेट में दुख रहा है, घर जाना है, जाने दो. एक पीरियड के बाद फिर मम्मी जाती है, लेके आती है, घर पे जाके नॉर्मल. तो 2-3 दिन ऐसा चला. तो मैंने स्ट्रेमोनियम दिया अफेक्टेशन लेके. तो 1 दिन गई, फिर वापस से चालू. अभी तो क्या करती है कि अब टीचर है ना उसको हाथ जोड़ के बोलती है मुझे घर जाने दो, मम्मी के पास जाने दो. बैगिंग में भी स्ट्रेमोनियम है, तो ठीक से दिया लेकिन कोई रिजल्ट नहीं मिला. फिर लास्ट में उसको एंटीसाइकेट्रिक से ठीक करना पड़ा. इधर क्या मिस हो रहा है?
बेसिकली चाइल्ड का रिएक्शन क्या हो रहा है? आप पहले उसका नीड था लव, उसका नीड था मदर. ठीक है. अभी मदर एक बार छोड़ के चली गई, ठीक है, तो उसकी नीड कॉम्प्रोमाइज हुई है, मतलब सोरा हैज बीन कॉम्प्रोमाइज. एडेप्टेशन क्या आया? स्कूल नहीं जाना है. क्यों? I want security and I want my mother in front of me only. If mother is in front of me, I will be safe. Okay. उसके बाद रिएक्शन क्या आया? Clinging is sorosyphilitic. ठीक है? But the reaction is sorosyphilitic. But the presentation behavior pattern was changed. What was the behavior pattern? He started making that कि मुझे ये हो रहा है, मुझे दर्द है. But for survival, what was that survival? That survival that I need to be with my mother only. Okay? Because mother अगर चली जाएगी तो मैं टॉलरेट नहीं कर पाऊंगी. तो मुझे मदर चाहिए ही. ठीक है? रिएक्शन क्या आ रहा है उसका? अब स्कूल जाना नहीं है. क्यों? क्योंकि मैं स्कूल जाऊंगी, मदर छोड़ के चली जाएंगी. सो दिस इज कॉल्ड एज सेपरेशनल एंजाइटी डिसऑर्डर. दिस इज कॉल्ड एज सैड. इन अ साइकियाट्रिक इट इज कॉल्ड एज सेपरेशनल एंजाइटी disorders. Mostly it happens in the young children. Okay. So in that you need to probe what was the most syphilitic reaction of the child. These are still psychotic reactions. Now what happens when mother is dead?
तब कुछ नहीं होता है.
तब कुछ नहीं होता है.
एकदम
क्या
नॉर्मल.
करती है?
ऐसा भी नहीं कि केयरेस करेंगी, हक करेंगी, ऐसा भी कुछ नहीं. एकदम नॉर्मल.
हाँ.
मम्मी क्लिनिक जाएगी तो भी चलेगा.
हाँ.
वो घर पे रहेगी.
हाँ.
स्कूल जाएंगे तो तकलीफ होगा. एक बार तो ऐसा किया कि स्कूल के बाजू में एक अपार्टमेंट है ना, वहाँ उनके कोई रिलेटिव रहते हैं. तो स्कूल से किसी को पता नहीं चले, वहाँ से वो अपार्टमेंट में चली गई और रिलेटिव के घर जाके बोलते हैं मुझे मम्मी के पास छोड़ जाओ.
So intelligence is so high.
Intelligence है.
Okay. Intelligence is so high. Again, the reaction is hysterical. So you need to probe a hysterical remedy which goes into separational anxiety. Okay. So we have a rubric that fear of losing loved one. This is the insecurity that is happening into the remedy sacrum album. Read that remedy from MATERIA MEDICA. Fear of losing loved one. Or we can have the rubric anxiety loved one about. That was the rubric. The remedy is sacrum album. Sacrum album wants love.
फियर होगा तो फिर उसके मम्मी के साथ ही रहेंगे ना.
Yes,
तो नहीं रहे.
but that is a losing loved one only. I was thinking like this way. If this patient came to me, I was thinking like this way. Reaction is clinging है, but clinging से उसका केस निकलेगा नहीं, क्योंकि clinging पूरा नहीं है.
क्लिंगिंग नहीं है लेकिन वो
हमने लिया clinging, पर clinging पूरा नहीं है. क्योंकि अगर क्लिंगिंग पूरा होगा तो पूरा दिन रात दिन उसके साथ ही चाहिए.
क्लिंगिंग नहीं लिया था, अफेक्टेशन इन मेनिया लिया था, क्योंकि आउट ऑफ कंट्रोल अफेक्टेशन जा रहा है.
और उसका कॉज नहीं लिया ना, रिएक्शन लिया, कॉज नहीं लिया.
रिएक्शन तो
affectation in mania, that means he need to survive on the basis of what? She need to survive on the basis of love of mother. So she goes into separational anxiety. That and it happens. The situation actually happens. If it is not happen, then a different story. This is a perception, but it actually happens. So that is what separation is happening, and after that it happens. So separation anxiety. So that separation is an ailment. Now she have a constant feeling that I might lose my mother. Okay.
लेकिन सर ने बोला कि रिएक्शन मायाजम होता है, तो यहाँ पे रिएक्शन आउट ऑफ कंट्रोल है तो पहले वही ठीक होना चाहिए.
Still fear, sir. Nowadays in the metamorphosis, sir has told that the fear is also a delusion. Because fear can create a perception. So perception already created, and out of that perception the reaction is like this. To my survival I need to be like this. My survival is my mother only. Are you getting me? My survival is my mother only. But I need to be, मेरी आँख के सामने मेरी मदर रहेगी, ओके, आई एम हैप्पी. मुझे उसको वो नहीं करना है, वो नहीं करना, दैट्स ऑल. तो मेरी आँख के सामने रहनी चाहिए. मेरी आँख से दूर गई, दैट मीन्स आई लॉस माई मदर.
क्लिनिक जाती है तो कुछ नहीं होता है, घर पे रहती है वो.
She feels that क्लिनिक का एक्सपीरियंस ऐसा हुआ है कि क्लिनिक जाती है, क्लिनिक से वापस आती है. पर जब घर से बाहर गई घूमने तो उसको क्या एक्सपीरियंस हुआ कि अब नहीं आएगी. Again you need to ask grandparents history. What happened in this 3, 4, 5 days when the mother father was there? Something is happening. So one missing clue you can find out from the grandparent history.
સ્કૂલે નહીં જતી. એક પીરિયડ થાય ને એટલે ફોન કરાવે, ટીચરનો ફોન આવે કે લઈ જવાની, રડે છે, પાછી આવી જાય.
Behavioral disease is the disease. Right now we have a physical disease, pathological disease, pathophysiological disease, and a psychological disease. So behavioral disease.
ઘરે કઈ નથી થયું.
એને મળી રહેતું હતું, અમે કયું પ્રેઝન્સ મળી રહેતું હશે.
So you need to probe two things. One is the grandparent history, and second is the history from the school.
સ્કૂલનું પૂછું પણ એવું કંઈ જ નથી.
એવું બી બને ને કાંઈને બહાનું મળી ગયું, સ્કૂલ નહીં જવાનું કે
That
મમ્મીને
That is
પેટ
what
માં
affectation he took.
લીધું હતું, એટલે
That is what
affectation
he
લીધું.
took the affectation mania in.
Affectation એટલે શું? Feeling
See, anything which happen having a ailment. So ailment was the actual process.
અને સ્ટ્રેમોને આપી ને એના પછી 2 દિવસ સ્કૂલે બી ગઈ નહીં.
Yes.
પછી પાછું બંધ થઈ ગયું. પછી પાછું આવું ચાલુ થઈ ગયું.
Temporary neurochemical has been dissolved again, but the cause has not gone.
પોતાની
cause
રીતે
is-
નોંધાયેલી પણ પછી કોઈ
Cause is
રીતે
what?
નહીં.
See, why she is sensitized? She sensitized when the mother and father went away. That was the ailment. So that is what she feels, that my loved one, my parent went away, leaving behind me.
પણ સડન નહીં હતું, મને ખબર હતી એક
ના,
વીક
પણ
પહેલા
મારા
કે
ખ્યાલથી
જવાના
સ્કૂલમાં
છે.
કઈ ઇશ્યુ છે?
તો પણ-
પેરેન્ટ્સના સાથે ઇશ્યુ નથી એને.
તો સ્કૂલમાંથી-
એને એ બહાનું લીધું મારા
તો
ખ્યાલથી.
પણ કંઈક કેવું હિસ્ટ્રી તો કંઈક
Age કેટલી છે?
Age
First,
કંઈક-
second?
ના, ચોથું કે પાંચમું ભણે છે.
Okay. So ask history person.
પણ અત્યારે તો એન્ટી સાયકેટ્રિક થી જાય છે રેગ્યુલર. આ તો એ જ એક્ઝામ્પલ હતું કે આપણાથી શું મિસ થાય છે આમાં.
Yes, that is what you miss. See,
History
basic history is missing.
હમ.
Only history is missing is, see, you need to ask the peripheral history, you need to ask the parallel history, and you need to ask the patient history. So parallel history means the school history, grandparent history, and then the patient's reactions and patient feelings. See, the reactions is just a khali behavior pattern has changed. Okay. Again, you need to ask, ki a behavior pattern came out. See, before that it didn't happen. See, the situation is, one situation happened is mother father went away. After that, this situation is happening. Okay. So some is stimulated. So there is a ailment. Now miasm has been gloomy, you can say, but the ailment goes into perception. Ailment goes into perception, and that perception lead to the behavioral pattern which is called as delirious state. So right now she is in a delirious state.
Which behavior?
See, this is what the state. Delirious state means ઘરે આવતા normal થઈ જાય છે. So that means it is not delirium, એકદમ mania state.
હમ.
Clear cut mania state. Okay. Fine. But the behavioral mania means what? He need to with the
એક સ્કૂલમાં હોય ને તો કંઈ પણ બહાનું આપીને ઘરે આવવું હોય, ઘરે આવીને એકદમ નોર્મલ,
okay.
ગમે તે બહાનું આવે,
So
પેટમાં દુખે છે, માથું દુખે છે.
you directly something you need to ask in a private about the child, what happened in the school.
નહીં તો મમ્મીને કહેવાય કે સાથે સ્કૂલમાં જાઓ. તો સિચ્યુએશન
Because
ચેન્જ થાય
this
પછી એના
situation
reactions
will
આવે છે.
make a clue that something is happening at the school, because problem at the school. Till that mother was there, the security was good. After mother went away, the security has changed. So who went to put the child into school, either in the van or either in the school bus, or either someone is taking the child to the school, parents, grandparents or something else.
આપણે પૂછીએ એટલે જવાબ એક જ હોય. મારી મમ્મી કશે ચાલી જશે તો
Fine.
જવાબ એક જ આપે.
હા, શું થશે કશે ચાલી જશે તો તને શું લાગે છે?
પાછી નહીં આવે તો
પાછી નહીં આવે તને શું લાગે છે?
પછી રડવા લાગે પેશન્ટ.
Fine. Okay, so what was that delusion? Delusion, mother is dead. Legacies. Did you get? Delusion, mother is dead. This is for the mother change. પાછી નહીં આવે, that means એના mind ની અંદર એ perception છે કે he lost the mother. So anxiety loved one, fear of losing loved one, perception, specifically delusion, mother, father અને કઈ લેવા દેવા જ નથી. Delusion, mother is dead. Right now છે છતાં બી એને એવું લાગે છે. And she is so manipulative. Very intelligent. Ophelia. Correct? Higher version. Perception level એ તમે જાઓ.
ક્લિનિક જાય ત્યારે બી હોવું જોઈએ ને જો એના ડિલ્યુઝનમાં હતા.
એનું એ perceptions છે કે એક
સ્પેસિફિક
Specific
સિચ્યુએશન
situation
પ્રમાણે
પ્રમાણે
પરસેપ્શન
એનું
લેવલ
perception.
થઈ ગયું છે એમ.
કારણ કે ક્લિનિક તો પહેલા બી
હા,
જતી હતી.
ક્લિનિક તો used to
ક્લિનિક તો
જતા ને.
પહેલા બી જતી હતી ત્યારે તો એને એ perception નહોતું આવ્યું. એને perception ક્યાંથી આવ્યું? સેપરેશનલ એન્ઝાઇટી સ્ટાર્ટ થઈ ત્યારથી. ઓકે, સેપરેશનલ એન્ઝાઇટી સ્ટાર્ટ ક્યારે થઈ? એક્ચ્યુઅલ સિચ્યુએશન થઈ ક્યારે? એક્ચ્યુઅલ સિચ્યુએશન થી એલિમેન્ટ થયો. એ એલિમેન્ટ થી એનામાં ઇન્સિક્યોરિટી ક્રિએટ થઈ એટલે ક્લિંગિંગ બિહેવિયર આવ્યું. એ ક્લિંગિંગ બિહેવિયર માંથી અફેક્ટેશન બિહેવિયર અને મેનિયા સ્ટેટમાં જતું રહ્યું. ધેટ ઇઝ આઉટ ઓફ કંટ્રોલ. ઓકે, સો એ એલિમેન્ટ માંથી ફિયર માં ગયું, ફિયર માંથી પરસેપ્શન માં જતું રહ્યું, એટલા માટે એ બિહેવિયર સ્ટેટમાં જતું રહ્યું. અગર એ પરસેપ્શન માં ન જતું રહ્યું હોત તો બિહેવિયર સ્ટેટમાં ન જતું.
આ સર ડિસ્ટોર્શન છે.
ટિપિકલ ડિસ્ટોર્શન.
હાયર પોટેન્શિયલ.
Yes, 10 m, 50 m, single dose. Legacies. Because highly manipulative અને ઘરે આવીને કઈ નથી થતું. That is very important. Delusion, mother is dead. There are 4 remedies. Delusion, mother is dead. Legacies, aurum, aurum, netronetum and capsicum. See, I don't know about capsicum, but capsicum also wants to remain at the homesickness. But not much in a perception level. Fine, go for the Ophidia because aurum is very straightforward, responsible, and whenever aurum gets separated, they are being responsible and diligent. This child is totally non-diligent, don't want to go to school. So that's great. This discussion will help us. Again, the emotions, anger, we will complete this emotion and then we in the next lecture we will go with the physical constitutions. Okay. So emotion, anger and anxiety. So up till now we have seen a fear and sadness. Now anger. So how anger comes? If he did not get a things he demanded, so most of time mother father told that sir जिद्दी बहुत है, जिद बहुत करता है, अगर उसको जो चाहिए वो नहीं मिला तो गुस्सा करता है, सबके ऊपर करता है, ठीक है, सिर्फ पापा को छोड़ दो. So he was timid against father. So you need to ask गुस्से में उसका रिएक्शन क्या है, right? तो शो करता है, आगे जा रहा है गुस्से से, सिर्फ इरिटेबिलिटी है, गुस्सा है, गुस्सा एक्सप्रेस कर रहा है कि नहीं कर रहा है, गुस्से के एक्सप्रेशन में किकिंग कर रहा है, बाइटिंग कर रहा है, थ्रो फेंक रहा है, स्पिटिंग कर रहा है, कुछ भी कर रहा है, दैट हैज द रिएक्शंस. गुस्सा एक्सप्रेस नहीं कर रहा है तो क्या कर रहा है? सैडनेस में जा रहा है, मोरो स्टेट में जा रहा है, सलन स्टेट में जा रहा है, फ्रस्ट्रेशन में जा रहा है, वेक्सेशन में जा रहा है. तो कहीं ना कहीं we need to find out that reaction according to the point. Other kid did not listen to him. अगर dominating है और जो वो खेलना चाहता है और सब बच्चे उसको हम तेरे साथ नहीं खेलेंगे, अरे मैं बोलता हूँ वैसे ही खेलना है, और उसके साथ कोई बातें सुनेगा नहीं, then he also got angry. ठीक है? Going to school every day, you start crying and vomiting before going to school every day. This is what the anger, what I said here. Okay? Most of time there is a anger. So something is happening in the van that the child was bullied by another friends, and he said patlu hai, patlu hai, patlu hai. That was a case of recent case. A child has been vomiting and nausea, especially morning when going to the school, and little bit fever, not eating well properly. So that child came, mother father says कि सर pediatrician को दिखा, pediatrician बोलते कुछ तो है नहीं, everything is okay, कोई प्रॉब्लम नहीं है, just acidity है, that will prescribe some antacids or everything, the child can get benefit. So they came to me. So I asked what happened. So that asked the child, whenever what happened to you? Then I probe periphery. कितने दोस्त है, क्या खेलता है? Then I started asking, दोस्तों के साथ मस्ती होती है कि नहीं होती? हाँ सर होती है ना. ठीक है. कोई स्कूल जाता है तो कैसे जाता है? वैन में जाता है कि पापा मम्मी छोड़ वैन में जाता हूँ? वैन में मस्ती होती है कि नहीं? हाँ होती है. कोई मस्ती करता है तेरी? हाँ सर वो आयांश है ना, वो मेरी बहुत मस्ती करता है. क्या बोलता है? सर वो मेरे को है ना पतलू पतलू बोलता है, वो थोड़ा मोटा है ना तो मेरे को धक्का मारता है. क्या होता है देखो, तो मेरे को गुस्सा आता है. क्या करता है? गुस्सा निकालता है. गुस्सा में कुछ नहीं बोलता, वो घर आके होता हूँ. मेरी मम्मी ये कीधु, he used to cry. So that is what he has anger, but he cannot express. Okay, and that anger is expressed in terms of nausea, vomiting, specifically in that area. So most of the school जाने के टाइम अगर बच्चा रोता है, ये करता है, तो you need to probe that things. Okay, mother is getting ready to go to the office. नहीं जाने देना है. Same way what Dr. Rajesh said. Okay, teacher asked him question and he has to answer it. तब भी यहाँ पे डर लगता है, एंजाइटी आती है. अगर जवाब गलत हुआ तो टीचर बोलेगी, डांटेगी, क्या होगा, मेरा जवाब सही नहीं होगा, तो दैट वाज अ एंजाइटी. ओके, हियर आल्सो देयर इज अ एंजाइटी, एंड इफ द ऑब्स्टिनेट चाइल्ड ही मे गेट एंग्री आल्सो. ओके, सो मदर छोड़ के चली जाएगी तो भी एंजाइटी आएगी. इट इज व्हाट वी हैव टू थिंक ऑफ.
એક કેસ હતો, એમાં એવું હતું કે ત્રીજા ધોરણમાં છોકરી ભણે છે, એક્યુટ કમ્પ્લેન હતી, થ્રોટ પેઇન હતું, સ્વેલોઈંગ એગ્રાવેશન, ડલ ચીલી ને થસલેસ હતું. પૂછ્યું શું થયું? એકદમ પતલી છે. શું થયું કે સ્કૂલમાં એક બે ત્રણ છોકરીઓ છે ને મને સૂકી લાકડી એવું કહીને બોલાવે. તો શું થયું? એટલે મને બહુ ગુસ્સો આવ્યો, એટલે મેં બેન્ચ ઉપર આ બુકો પણ માર્યો, પણ મેં ઘરે કોઈને કીધું નહીં. અને એ દિવસથી એને થ્રોટ પેઇન ને ફીવર ને બધું ચાલુ થયું. બીજું શું કે તાવ આવ્યો ને પછી તો બહુ ખાવાનું માગે છે, કંઈક ને કંઈક ખાધા જ કરે છે. તો એપેટાઇટિસ ઇન્ક્રીઝ, અને સ્ટેફિસ એગ્રી આપી, બીજા દિવસે બધું ક્લિયર.
Absolutely perfect. Steph is agree. Ailment from anger suppress. Okay.
તાવ આવે તો પણ ટ્યુશન વધે જાય.
Increase fever during. બરાબર. અને in spite of fever they go into school and tuitions. Diligence. So diligent remedy in spite of fever. Silica, Stephysagria, natrum carb. Acid fast. Acid fast can be both diligent, non-diligent. They can go in spite of fever into school. Okay. Fine. So ailment from overjoyed and excited. So most of time you need to ask, whenever you ask all the ailment, कि कोई गुस्सा हुआ था, कुछ डांटा था, सर कुछ नहीं हुआ, प्लीज यू आस्क, कुछ तो अच्छा हुआ होगा, पार्टी में गए थे बट हाँ सर कल इतना एंजॉय किया, इतना थक गया ना, उसके बाद ही इसको बुखार आ गया. एलिमेंट फ्रॉम ओवरजॉय. अटेंडिंग बर्थडे पार्टी, गेट सरप्राइज गिफ्ट, एक्साइटेड अबाउट गोइंग ऑन अ ट्रिप. So most of time this happens. So ailment from overjoyed. Opium, opium, aconite. These are the remedy comes into sudden fever, aconite, ailment from overweight, sudden fever, opium. Okay. So causative factor guide us to know the sensitivity of that child. It tells us about the constitution of the child, as sensitivity belongs to constitution, whereas reaction tells us about the miasm of the patient. So we end up today. We will continue physical, and then later on our case series will going on. So this discussion will help us to go deeper into processing, go deeper into understanding of the each and every case, as well as case processing and case analyzing. So again, sometime we need to go higher. Okay, that's all from the day. So thank you so much for the wonderful class. We will continue the series again and again and again. So we are benefited. Thank you.